Let me tell you about a case of adenomyosis. Firstly, what is adenomyosis? Adenomyosis is a very common disorder. Women beyond 35 years suffer it very commonly. It's a disease of the myometrium or the muscle of the womb, wherein instead of a linear muscle arrangement, it becomes a very irregular muscle arrangement with striations, with cystic spaces, with the development of a small tumor, or just increase in the size of the uterus. This couple came to me saying that they are having adenomyosis, has been diagnosed, and they want to know whether this adenomyosis needs to be removed or it will need some kind of a treatment before they embark onto further treatments. This lady was about 37-year-old and she was having a very low ovarian reserve. So when we counseled her, we said there is a possibility of you going for an egg donation cycle. But she was not willing to wait and take treatments enough to suppress the adenomyosis. I said, I need to do a hysteroscopy for you to know whether this adenomyosis what you're having is having an effect on the endometrium or not. So when we do a hysteroscopy, we found out that she had a stromal edema. There was swelling of the endometrium, like a fluid swelling, and she had punched out lesions in the endometrium, which says the adenomyosis is trying to penetrate the outer layer of the inner lining of the womb or endometrium. Now these are the women, even if you try for pregnancy, they wouldn't get pregnancy. So I convinced them, well, you need a treatment for adenomyosis. We need to subside it by giving some kind of good medical therapy and then only put your foot forward. So when it comes to patients of adenomyosis and fibroids, it is better to do a thorough evaluation, just not an ultrasound, but a thorough evaluation to understand whether it has an effect or any repercussions onto the endometrial lining so that a correct decision can be taken. Thank you.